domain on the neo-personality inventory that we find significantly different in groups of pathological gamblers compared to non-pathological gamblers is the domain of conscientiousness. And the specific facets on this particular domain as measured by the neo-personality inventory are a tendency to have a lower sense of competence. They have a lower opinion of their abilities. They may often feel unprepared or feel inept on average as a group. We also find this deficiency or lower scores on a facet called dutifulness. And this means that for on average as a group, pathological gamblers feel less maybe scrupulous about their ethical principles or inclined to fulfill moral obligations. So what that means is they potentially will be more lackadaisical in those obligations, and therefore they may be incongruent with those values and beliefs that they may have. Certainly we see that in terms of patients with pathological gambling who often may be prone to make decisions that others would consider amoral in nature. Finally, we find that they have lower self-discipline. That's not to be confused with impulsivity. Self-discipline on the neo-personality inventory is about this difficulty following through on tasks and getting things done, especially in the wake of boring or mundane or routine. In fact, patients with ADHD, not surprisingly, have lower scores on the facet of self-discipline. Self-discipline is somewhat different and unique from impulsivity. Impulsivity is the inability to resist doing something that you don't want to do. You want to abstain from that. Whereas self-discipline is the inability to actually follow through and complete something that you want to accomplish. And it has to do a little bit more with these lack of motivation or ability to perhaps focus and concentrate. That's often implicated in following through on tasks and getting things done. They get distracted a little bit more easily. So even though self-discipline and impulsivity appear to be somewhat similar, there's some unique differences between those two facets as they're measured on the neo-personality inventory. And then finally, we find lower scores on a facet called deliberation. Deliberation has to do with this tendency to be hasty in decision-making without really thinking through or a few steps ahead, like, okay, is this going to be a good decision? They often make quick choices on the spur of the moment and don't consider the consequences of those choices and how they might affect other people, including themselves. And at best, the characteristic of this deliberation as measured by the neo could be labeled as spontaneous, but for the most part, it's not necessarily considered if they have low scores, which as a group the pathological gamblers did, compared to the non-pathological gamblers. It tends to reflect what we see, clinically, is they're hasty in decision-making in terms of their gambling behaviors, and for many gamblers in other domains of their life as well.